I'm originally from New York. I completed all of my academic training in the northeastern US. I'd never even been to Montreal previously before my job interview, yet the job notice when I saw it really captured precisely what I do, and it was love at first sight when I saw the Concordia Loyola campus, and that's what brought me to this university. Since arriving at Concordia, I've been extremely fortunate to have built a flourishing research program in the Department of Psychology and now through the Perform Center. I supervise a team of very talented graduate students and collaborate with scientists from all over. Working with graduate students, I get to train the next generation of scholars who bring Concordia's signature big thinking to the world. As an example, I'm extremely proud that my first undergraduate student who completed his honors thesis with me was just awarded his PhD last month, and he's headed to Columbia University in New York for his postdoctoral studies. Day to day, my research focuses on how sleep impacts heart health and obesity in kids. Specifically, my research examines why poorer families have poorer health. My findings so far lead me to believe that the stress of being poor literally gets under people's skin to affect their health, and stress seems to make its biggest impact while we're sleeping. Sleep is critical to good health, and yet because of our 24/7 society, sleep is decreasing. We're exposed to bright light, meal times are later, activity no longer coincides with daytime and daylight hours. Our environment is making our brain lose its rhythm. We're sleeping less now than we did 4 decades ago. Since 1975, we've lost 25% precious sleep time. And less time spent sleeping not only affects us, less time also affects our children. Today, most teenagers and adults have a television, computer, or other technology in their bedroom. They fall asleep while text messaging their friends. Teenagers are sleeping less than previous generations. Adolescents' bedrooms are bathed in blue light with smartphones and tablets, and that extra light actually impacts body weight. Even low levels of nighttime light, magnitude of even 5 lux, can increase your body mass. And while our sleep has been declining, it actually mirrors the obesity epidemic that's been increasing over the past 4 decades. As a society, most of us are not sleeping within our normal sleep window. Our body's internal clock, our circadian rhythm, it's getting misaligned. Lack of sleep leads to social jet lag. Social jet lag is associated with increasing obesity and weight gain, and social jet lag can also cause learning troubles and behavioral problems among children. Curiously, social jet lag is most acute during adolescence. And to compensate for sleep debt that's been accumulated over the school week, teens commonly oversleep on weekends. The older they get, the more likely teens are to sleep late. Half of adolescents in secondary school go to bed after 1 a.m. on weekends and long holidays. So consider, if an adolescent goes to bed at 1 a.m. on a Friday, and they sleep in until 11 a.m. on Saturday, this causes a phase delay in their circadian system. Then they shift back to that earlier wake time come Monday morning, and this requires their body to have to try to stabilize hormones to return to that normal circadian rhythm. And this sleep shift basically means that the teen is traveling across several time zones every single week. Greater consistency in daily routines actually appears to be protective, particularly for children, against obesity. Preschoolers who have stable routines, consistent bedtimes and wake times on school nights and weekends, and regular family meal times exhibit 40% lower prevalence of obesity. Adopting healthier habits to live better is the mantra of the Perform Center and its research community. In my lab, I see families from all walks of life. Whether they're homeless or wealthy, we all have one thing in common. They're concerned about the health of their children. With each study that I undertake, my goal is to ultimately shape government policy to ensure a better future for our children. Helping one family is great, but helping a community equip itself to raise its children takes healthy living to another level. Teaching and working at Concordia gives me latitude to collaborate with colleagues all across the world. I collaborate on research with the World Health Organization. I work with colleagues from the US, Sweden, the Netherlands, the UK, and Australia. During my sabbatical last year, I was a visiting professor at Harvard University, learning more about the big data revolution. And today, thanks to generous support, I now hold the inaugural Perform Chair in Childhood Preventive Health and Data Science. And my Perform Chair has allowed me to recruit a postdoc that I met at Harvard to help create a data science platform here at Concordia for researchers. And Concordia Research is not just making a difference here, we're making a difference around the world. I was thrilled when Dr. Sanjay Gupta, who you probably know from CNN, featured my research in Time magazine. Since embarking on my Concordia career, I've worked hard to secure research funding, and however significant, that funding does not cover all of our needs and doesn't always allow for us to acquire the necessary technology that we need. For example, if I was able to purchase more sleep technology, this wearable equipment to measure how kids are sleeping, it would mean that I'd be able to include more study participants. More participants means faster data, which leads to faster and richer conclusions. Tonight, I represent Concordia's growing group of researchers who rely on a combination of public and private support to advance their research. And it is my distinct pleasure to thank each of our builders for supporting research that can meaningfully answer questions to today's biggest concerns. Your support truly builds a better, stronger, healthier world. And together we are helping to make a difference. Thank you.